Welcome to our program today. My name is Libby Kennard, and I am the program lead for Parkinson's Resources of Oregon. Parkinson's Resources of Oregon was founded in 1980, and our sole focus is to provide local services to individuals and families facing Parkinson's disease. We have a staff of 11 employees and a board that includes people who have Parkinson's, healthcare professionals that specialize in Parkinson's, and then other caring community members. Most importantly, we have many dedicated volunteers, and they contribute to helping us fulfill our mission. This is a list of our services in addition to educational programs that were gathered for today. We also have our helpline services where you can speak directly with us. We know the local community and will help connect you to the resources you're looking for. We have a network of support groups. We have a new peer-to-peer program. We also have social work services for the person living with Parkinson's and their family. And then there's also in-person and online wellness classes. We are local. We serve Oregon and Southwest Washington. We have offices in Beaverton, Bend, and Eugene. And the points on this map at the time we created this show our support groups. But now that we've returned to doing more in-person programming, we've had more groups popping up. So that's now out of date. I would like to thank our annual sponsors, AbbVie, Amneal, Boston Scientific, and Supernus for making educational programs like this possible. Okay. Okay, now we'll get started. I'd like to introduce our speaker, Chris Eilers. He's an older adult behavioral health specialist, and he's been part of the Older Adult Behavioral Health Initiative in Oregon since 2015. He focuses on education that's both enlightening and relevant to both healthcare and aging services professionals and to the community at large. From planning conferences on mental health to providing professional training like mental health first aid and trauma-informed care, and then saying yes to special requests like this, Chris is really an expert on the unique needs and challenges people face when living with a chronic condition like Parkinson's disease. So we're glad to have you here, and I will let you take it.
Thank you. Welcome, everyone, and thanks for attending. Again, my name is Chris Eilers, older adult behavioral health specialist. Just a few things before I get started. This is a two-part series, so we're having an additional hour next week, same bad time, same bad channel. And today I'm really going to give you a lot of information. Next week is really intended for more of a discussion. Even though I will be presenting some information, I'll save a little more time for questions. However, folks that are watching the chat, are recording those entries. That gets recorded. So if you have questions that come up, feel free to type those into the chat, and then I'll have those questions to address next time. So I'll just start sharing my screen. Again, you've got a couple of people watching the chat. If you have technical difficulties, let me know, or let them know if you have any kind of challenges in accessing material. And just a reminder to everybody to keep yourselves muted. All right. So I'm here today to talk about managing anxiety. And as you may or may not know, anxiety is a little different for people with Parkinson's disease. So I'm going to get into some of the details about Parkinson's and anxiety that are different than the average population. Here's a little information about the Older Adult Behavioral Health Initiative. It started in 2015, and it's funded by the Oregon Health Authority. We have specialists in all counties. There's about 25 of us across the state. And the two listed on the screen here are the ones for Lane, Lynn, and Benson counties. So we cover all three of those counties. And my contact information is here in case you want to reach out. We do contract also with Portland State University to provide some of our content, as well as collecting data for us and giving reports to the state legislature. The other activities that you see here on the screen are complex case consultation and then care coordination. So those are both things that I engage in on a regular basis. And care coordination is really around accessing mental health services. So anxiety, what is anxiety? A feeling of unease, such as worry or fear, which some people with Parkinson's may experience, but there are steps you can take to help manage your symptoms, including treatments, therapies, and self-help techniques. And that's what I'm going to really focus on today. And you may notice that each of my slides is going to have a link on it. If it doesn't have a link, then the information is probably from the last slide with a link on it. So I really try to give references for all of the information that I'm sharing. And the majority of the information today is from specific resources around Parkinson's disease. So as you can see here, we've got this parkinsons.org.uk. So that's where this information came from. So what are the symptoms of anxiety? Anxiety is something that a lot of us feel a lot of the time, but it's at low enough levels that it doesn't really interfere with our quality of life. And in fact, it's necessary to keep us safe. We feel fear when we're in danger. And if we didn't, we might get hurt more often. So anxiety is something that really drives our behavior, typically in a positive way. It's just when it becomes overwhelming or causes avoidance behaviors that it becomes a disorder. But as we'll find, it can become more of an issue for people with Parkinson's than the general population. My keyboard's not responding. There we go. A sense of dread, constant worry, difficulty concentrating, feeling unable to relax, difficulty sleeping. So these are some of the mental or psychological symptoms of anxiety. But you might experience physical symptoms as well. So you have sweating, a pounding or racing heart, tightness of the chest or feeling breathless, dizziness, trembling, indigestion, nausea and stomach ache or cramps, headaches, loss of appetite, a dry mouth, muscle pain and tension, restless legs, and difficulty maintaining restful sleep. Oops, sorry, let me go back to that list. So these are the symptoms people typically talk about, the physical symptoms. People don't normally bring up their mental symptoms or thoughts and feelings, particularly when they're talking to a medical professional, right? A medical professional asks you, how are you feeling? And you think about your body. You start talking about these physical symptoms, but you forget that how are you feeling is also a question about your mind and your thoughts and feelings and emotions. So we really need to focus on both sides of the story. And I'm going to get into that a little bit more, how to really communicate with medical providers how anxiety is impacting you on a daily basis in order to get the right kind of help. So the most frequently reported fear among all older adults, not just people with Parkinson's disease, is falling. And I can see it being an even greater concern for someone with the diagnosis. But this is the most frequently reported fear among all older adults. And when we start with fear, what we find is that leads to limiting activity. So fear of falling, which typically happens after someone has fallen, and maybe it was painful, it was embarrassing, but not necessarily requiring medical attention at the moment. Even in those cases, that can lead to a major change in behavior. And that's based on fear. So the fear of falling leads to avoidance behaviors, stopping activities, which results in limiting your mobility. We have to use our muscles to keep them healthy. And when we don't use parts of our body, they tend to atrophy and deteriorate. So that limited mobility leads to isolation, because as you become less mobile, you become more afraid. And the isolation and lack of physical fitness leads to an increased risk of falling. So it's basically a self-fulfilling prophecy where someone's afraid of falling, so they avoid doing the things that they really need to do to improve their physical fitness. So how do we stop that cycle? So if I were to look at this entire chart, where would I choose to break the cycle? Right here with increasing activity. This may mean a little bit of talking about fear or adapting to circumstances so that the fear isn't as intense, so that the increasing activity can be allowed to happen. But sorry about that. Use of adaptive devices. This is actually on the slide before. This is a way to reduce fear. So if someone's afraid of falling, giving them something to lean on, whether that's a walker or a cane, crutches, whatever works for them, will help them to feel more safe when walking, and then they can stop avoiding behavior quite so much. So if there's issues around fear and someone's really refusing to try getting out and walking, give them something to hold on to, and that might help. So in order to increase activity, we do still have to deal with a little bit with the fear ahead of time. But that increased activity is going to actually enhance mobility. And as someone is more active, they're going to feel stronger. So they're allowed to increase their physical fitness. That leads to increased social interaction and decreases the risk of falling. So that's how we break that vicious cycle. So the fact is that people with Parkinson's disease have higher rates of anxiety than the general population. Anxiety disturbances are recognized as common psychiatric comorbidities in Parkinson's disease. They contribute to significant impairments in areas of cognitive, functional, motor, and social performance. Anxiety in Parkinson's disease results in a reduced quality of life, higher levels of care dependency, and increased caregiver burden. Sure, that's not new information for you. What was surprising to me was that clinically significant anxiety symptoms occur between 20 and 50% of Parkinson's disease patients. And that is much higher than the general population, even in older adults. Typically, we see between 10 and 12% of adults having anxiety within a given year. And so these rates are significantly higher than what we would expect to see among the general population. Patients with Parkinson's disorder, regardless of gender, also experience panic disorders and social phobias with a prevalence of approximately 30%. Again, much higher than the general population. Anxiety and depressive syndromes frequently co-occur. So depressive disorder can be found in 92% of Parkinson's disease patients diagnosed with an anxiety disorder. So that means the vast majority of people with anxiety also have depression. Also, anxiety was present in 67% of people with depression. So these are comorbid conditions, which means that they influence and exacerbate each other. The good news about that is the treatments are the same. So if you're addressing someone's anxiety, you're also addressing their depression and vice versa. And there's multiple ways to address both conditions that will improve them both. So don't think of it as a double whammy necessarily. You can really recover from anxiety and depression simultaneously. So looking at diagnostics, how do we know if someone has anxiety? The typical method is to use a screening tool. And so we have something called the GAD-7, Generalized Anxiety Disorder 7. And there's 7 questions on here. And you basically get a score by saying how often these things have happened in the last 2 weeks. And this is a tool you should be familiar with because in reality, everyone has Medicare is supposed to have an annual well visit with their primary care physician where they take this screening, as well as PHQ-9, which addresses depression, as well as the SLUMS or AMOCA, which look at dementia. So if you're not familiar with this, don't be upset with your doctor. That's not a good thing if you haven't seen this before. Now, you're going to get a score by answering these questions, but that's only one piece of information. And you can analyze that score looking at the bottom. 0 to 4 is minimal, 5 to 9 is mild, and then 10 to 14 is moderate anxiety. But there's another portion on this screening tool that's important to look at, and that's the box in the middle. It says, if you checked any problems, how difficult have they made it for you to work, take care of things at home, or get along with people? So you might have a low score. You might be at a 4. But if someone is marking that score, the problems related to that score are making things very difficult. Then you have what we call subsyndromal anxiety, which means you wouldn't necessarily meet criteria for a diagnosis, but the anxiety you do have is having a huge impact on your quality of life. And in that case, treatment is still recommended. Some kind of care, some kind of change in lifestyle has to occur in order for those things to get easier. So always something important to look at. Now here is generalized anxiety disorder. And if I were a psychologist asking you questions, these are the answers that I would want to look for. The DSM-5 is the manual that mental health professionals use to determine diagnoses. So I'm not going to go into a ton of detail on this because there's a lot of information here, but you can see that there's a fairly high bar to reach to have a diagnosis of generalized anxiety disorder. 3 out of the following 6 symptoms: restlessness, being easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbance. So you'd have to have 3 of these symptoms for at least 6 months in order to get the diagnosis of generalized anxiety disorder. So again, when you're talking with a physician, that's what they're looking for to give you this diagnosis. If that conversation is not resulting in changes or treatments that are being recommended, talk about the difficulty that you've observed. I know my symptoms of anxiety aren't meeting the criteria, but it's making my life really hard. Isn't there something that we can do? So here are a list of anxiety disorders, and generalized anxiety disorders at the top because it's the most common. And I've already shown you the definition of that. 14.1% of individuals with Parkinson's disease have generalized anxiety disorder. Again, that's higher than the general population. Social anxiety disorders are persistent and excessive fear of social situations, of being judged negatively by others. A lot of reasons why someone with Parkinson's would feel this way. They might have some kind of physical attribute that they stand out, they attract attention, and that can be embarrassing. So that could lead to social phobia just based on the symptoms of Parkinson's. And 13.8% of individuals do have a social phobia. Agoraphobia is being presented a little bit differently here. You think of it usually as a fear of leaving the house. Here, agoraphobia really is an excessive fear of situations where it's difficult to escape or receive help. And again, thinking about anyone with a disability of any kind, this is a serious issue. I mean, this is something that's very understandable, that they would have a fear about being trapped, being stuck in a place where they can't get assistance or help. And so they don't leave the house, or they don't go very far. They only go to certain places that seem extremely safe. So it leads to this avoidance behavior that I was talking about, that again, kind of undermines physical fitness. But again, very understandable that someone would feel nervous about taking public transportation, using public spaces, going to a shopping center, being in tight quarters with other people. And so 8.6% of people with Parkinson's have this disorder. And then you have panic disorder, which is a regular occurrence of sudden episodes of intense fear associated with severe physical reactions while there's no real danger or apparent cause. People may think that they're having a heart attack or dying. So when someone has a panic attack, it's a physiological state, and it's being driven by what we call positive feedback loop. And so there's a trigger that causes a neurotransmitter, a hormone to be released, adrenaline, cortisol, and that starts a chain reaction in the body that then feeds off of the fears of the mind. And so as the body starts to respond to this trigger, fears start to populate the mind. Why am I having trouble breathing? Why am I sweating all of a sudden? Why is it really hot in here? And then they look for reasons to be afraid. So it's a response to a physiological process, but people look for reasons that they're reacting this way, and those thoughts tend to spiral and really drive the physiological response even further. And so that's why people feel like they're having a heart attack, because their heart is running away with them. Their heart rate is increasing, their blood pressure is going up. There's no real good explanation for why it's happening. And so they might think they need medical attention, and in fact, they may. So if someone says they are feeling this way, even if you know it's a panic attack, it's usually important to get some kind of medical attention at the time, just to make sure that it's not a cardiovascular event. And 6.8%, again, this is much higher than the general population. We'd see like maybe 1% of older adults with panic disorder who don't have Parkinson's disease. So why is this happening? What are the causes? Why do people with Parkinson's tend to have higher rates of anxiety than people without? Well, it's not really clear, unfortunately. We have a lack of knowledge of the underlying mechanisms that are driving this behavior. There is involvement of the dopaminergic and serotonergic pathways. Libby's probably better at saying that than me. So we know that Parkinson's results in a lack of dopamine or dopamine receptors. There's something in the dopamine process that's not happening. And so we also know that dopamine and serotonin play roles within kind of emotional regulation. And so these two pathways tend to balance and kind of assist each other in maintaining either parasympathetic or sympathetic stimulation, which is whether our body is in a fight or flight mode or in a healing mode. These two neurotransmitters really kind of control that. And so when we know that the disease is impacting one of these neurotransmitters in a significant way, there seems to be some involvement with that around anxiety. So to get into a little more detail, degenerative lesions of Parkinson's disease disrupt the limbic striatorchical circuit. So cortical is like cortisol, right? So you've heard of that neurotransmitter before. And the limbic system is the most primitive part of our brain. And that's the part of our brain that controls fear, emotion, and memory. It's also called the lizard brain sometimes. And it includes the amygdala, which is really the center of our fight or flight response. And so when you know that the limbic system is impacted by Parkinson's disease, again, another situation where our emotional regulation is more difficult and challenging because those parts of the brain are compromised. So finally, the amygdala and the anterior cingulate cortex, which are key structures in the neurocircuitry of fear and the processing of emotions, seem also to be involved. So the brain chemistry of Parkinson's disease is setting people up to have higher rates of anxiety and depression. That's the basic explanation. So an imbalance between the fear and the limbic circuits is at the origin of anxiety for Parkinson's disease. Now, the reason this is important to know, first of all, is so that you can predict that anxiety is a fairly common condition for people with Parkinson's disease. So even if someone doesn't have it now, there's a chance that they will develop it later. The other reason it's good to know this is that people blame themselves for having mental health conditions. And this is a disease. So to normalize that and say, this is just part of the picture of Parkinson's, really allows someone to back off of that sense that there's something wrong with them in particular. There's something about their character or something I can't handle, having Parkinson's. because I have anxiety. Well, anxiety is part of having Parkinson's. We also have, in general, an increase in ageism. And some people think this is a result of the COVID-19 crisis. So the way that COVID-19 really was presented, what happened there? Too far. That people who are older or have some kind of chronic health condition are at the greatest risk of dying from COVID-19, which is true. And that means that those people should isolate themselves from everybody else, which in some ways is an effective strategy to not get COVID. It's not an effective strategy to live your life. And the way that the health recommendations were laid out has had a larger impact on ageism than was previously intended, obviously. There are negative side effects to some of the public health directives. And one of them is that older adults lost their optimism about being older. They started to see being older as a negative thing. So it's an internalized ageism. We know we have external ageism where our society values youth and really kind of ignores aging in some ways. This is also happening inside our own minds. When we look in the mirror and we see gray hair, does that make us feel wise and experienced and confident? Or do we see that and feel at risk? Because being older means being more susceptible to something like COVID-19. And that's internalized ageism, to see your age as a negative rather than a positive. So this article is really interesting. So I'd encourage you to check it out if you have some time. But there are additional reasons that people who are older have anxiety in addition to the Parkinson's disease. And part of that is feeling worse about aging. So that brings me to the role of stigma. So we've stigmatized aging, stigmatized physical disabilities. That's something that is not, promoted in our society as a good thing. And we've stigmatized mental illness. So those three things together are really impacting people's willingness to access care or even talk about their symptoms. Some people with Parkinson's disease don't understand that the changes are the result of the disease, which makes it more difficult to talk about. Others, influenced by stereotypes associated with mental health, fear being stigmatized by talking about it. So the overlap with depression also makes the diagnosis more difficult. Remember, 92% of the people with anxiety also have symptoms of depression. So Parkinson's disease-related anxiety is under-recognized and untreated. A lot of times that's also because the symptoms get lumped in with everything else that's going on. And really focusing on, like I said, thoughts and feelings, emotional symptoms is a way to tease out anxiety. So what are the treatments available? Adjustment of the dopaminergic treatment. So we already talked about the involvement of the dopamine pathway in the development of anxiety and the regulation of fear. So physicians can look at that and see if there's a way to address it that way. One way to do that is to look at also serotonin. So again, that's a neurotransmitter that kind of balances with dopamine. So serotonin reuptake inhibitors, which are typical antidepressants, are often used for anxiolytic purposes, which means reducing anxiety. Benzodiazepines, which are commonly used to treat anxiety, not really recommended for people with Parkinson's because they are a central nervous system depressant. And so they actually increase the risk of falling, negative impact on cognition and habituation of learning. So people are less able to learn on benzos, and they're more likely to develop a cognitive disorder if they're taking that. It's very similar to alcohol and its chemical makeup. CBT is a very promising therapy. Cognitive behavioral therapy. A recent randomized controlled trial has shown that cognitive behavioral therapy significantly and sustainably reduces anxiety in Parkinson's disease. That's really good news if you can find a therapist. But that's been challenging lately as well. But if you are working with a therapist, cognitive behavioral therapy is really the top choice. Relaxation. So complementary therapies have also shown some benefits, things like yoga, mindfulness, and breath control. And I know there was a question actually about panic disorder ahead of time. And one way to address panic disorder or panic attacks is to guide someone through breathing. And one of the techniques is called 4 square breathing. I'll kind of describe it. It's fairly simple. You breathe in for 4 seconds, you hold your breath at the top for 4 seconds, breathe out for 4 seconds, and then hold your breath again for 4 seconds. So it's 4 sets of 4. And you want to make sure that the breath is coming in through the nose slowly and out through the mouth slowly. And that's called 4 square breathing. And you want to count 1, 1,000, 2, 1,000, not 1, 2, 3, 4. Or 1 Mississippi, that works too. But that is one way to help someone guide them through breathing. And the reason that this works is, as you may be aware, if your heart rate is too high, making you uncomfortable, we all know that you can hold your breath and that slows your heart rate down. So this 4 square breathing is really the most effective way for you to manage your blood pressure. And as soon as we're able to get our blood pressure to start decreasing, then we're going to see that shift from the fight or flight or sympathetic nervous system to the parasympathetic nervous system, which is the healing part of our nervous system. So if we're able to make that shift physiologically, our thoughts will follow suit. So you don't really need to focus on what someone is thinking. Guide them through the breathing, and their thoughts will moderate and stop spinning out so much. Again, next week I'll be able to address more questions about that. The truth is that knowledge is power, and that's why we're doing this class, right? Just knowing that Parkinson's is more likely, anxiety is more likely for people with Parkinson's disease means that not only the individual, but their family members, their caregivers are aware that this is part of the disease. It's one of the symptoms. And that by managing the disease in general, they could see some improvement in anxiety. And there are ways to improve anxiety that will actually benefit the individual in multiple ways. Emotional regulation is important because all of the physiological processes associated with anxiety actually have a negative impact on the body and the brain. So if you can moderate anxiety, you're going to see better overall health outcomes. So living with anxiety, we know that people with Parkinson's have higher rates of anxiety. There is not necessarily a cure. There are ways to manage anxiety. If you're taking a medication that makes it so that you're no longer afraid, it's probably also taking away a lot of other things, your motivation, your ability to think clearly. So we do have to manage these symptoms through lifestyle choices, through changes in our activities and behaviors. So keep a diary of your moods, medications, and Parkinson's disease symptoms. Figure out what triggers your anxiety. There typically is something in the environment, some kind of interaction, some individual that tends to make anxiety worse. So if you know what those things are, then you can really start to pinpoint, what's triggering this and how do we manage it better. Talk with your doctor about anxiety. Tell your care partner and family members how you're feeling. Keep them up to date on your emotional wellness so they can understand your emotions better and help you cope. I think caregivers feel better about their role when they're part of a team, right? When they know that this is a partnership and you're going to share with me how you're feeling from one day to the next. Find a support group for people with Parkinson's disease. Libby just talked about that at the beginning of this meeting. And it's really important for people to be socially connected. I don't know if you've seen the Surgeon General's report earlier this week, that social connection is actually a prevention strategy for things like suicide and anxiety. And that not having social connections is a risk factor for all sorts of other chronic health conditions like heart disease, stroke, and dementia. So these support groups can become extremely important in your healthcare journey. It is part of healthcare to manage your emotional wellness. Be flexible in your approaches to coping with anxiety and try different approaches. I'm going to share some of those soon. And there's a lot. There's a big variety of things that you can do. And if you try something that doesn't work, don't give up, try something else. Understand that symptoms change. If a coping strategy stops working, try a new approach. As you progress, through managing anxiety, you might have new issues come up, new situations that you have to manage. And know that everyone experiences anxiety differently. There isn't a handbook, for people. Well, there is a handbook for helping people with anxiety, but there's not a rule book, let's say, for people with anxiety. You have to feel one way or another. If it's impacting your life in a negative way, that's a good reason to do something about it. So, like lifestyle modifications, planning ahead and giving yourself enough time to accomplish your tasks. Now, again, this is from a specifically Parkinson's related source, but it applies to really everyone who has any level of anxiety. A lot of the things I'm saying are very general. So this is good advice for pretty much anybody who's stressed out, right? Plan ahead. Use music to create a relaxing environment. I don't know if you're aware, but it's Mental Health Awareness Month, May, right? So that's why we're talking about this partially. And the Mental Health America, their current campaign is look around, look within, I think. Kind of odd, but their main point is look at the environment that you're in and try to assess how much of your mental wellness or lack thereof is connected to the environment that you're in. And how can you change that environment? How can you make, adaptations so that it's easier to live there? And I think music's a really nice thing. It's something that I sometimes forget. I'll be doing something, concentrating, and then I'll realize this would be a lot more fun if there was just some background music playing. And I'm always glad when I realize that and put some on. I'm always having a better time if that's happening. So small ways to make your environment more conducive. Focus on maintaining your positive attitude and sense of humor. It's hard to have a chronic health condition and one that will be with you for the rest of your life. That's really a emotionally challenging circumstance. So ask for help with this part, right? You're not going to be able to do it by yourself. I'm just going to maintain a positive attitude all the time. You need help with that if you have a chronic health condition of any kind or disability. So reaching out, making those connections, and seeing opportunities for humor, right? Seeing those opportunities to maintain a positive attitude and letting people know I'm struggling with this right now. I'm having trouble having a positive attitude or sense of humor. Help me out, right? Social interaction can do so much to change our mood and our attitude, but we do have to reach out to get that help. Socializing with positive people, again, to facilitate this positive attitude and sense of humor. We have to find joy in life. Getting involved in worthy causes like Parkinson's Resources of Oregon. When I have been at a couple of events, I love the fact that people with Parkinson's and their caregivers and families are the ones really driving, the movement. They're the ones out there volunteering, getting the word out. And it's fantastic. It's a way to contribute to your community and have fun, make social connections, and really feel like something you're doing is making a difference. The need for meaning is very central to being a human. And that doesn't change when you develop a chronic health condition. You still have to have meaning in your life and feel like you can have an impact on the people around you. Attending a support group, again, I'm going to plug that again and again. Exercise. There's challenges around this, obviously, with a physical disability. Finding ways to engage in physical activity, even though there are barriers and obstacles there. And talk to your physician about that. Do you need a physical therapist? Do you need a personal trainer? What do you need to do to really be able to continue to be physically active? And then meditation. And I don't necessarily mean Buddhist meditation, even though that's obviously good. I like to think of meditation as anytime you are alone with your thoughts, thinking about thinking, right? More like mindfulness. anytime that you are planning for the future and kind of what, is your idealized future, you visualize that for a minute. Maybe you pray to, whoever guides you. These are all forms of meditation and mindfulness. But having the time and space, taking that time and space to do that is critical and really helps with emotional regulation. Knowing what your goals are really helps you to move towards them. So taking the time to think about, what are my priorities? How do I optimize? Knowing that you have limitations sometimes puts you in a place of making hard choices and choosing the things that have the most meaning, that have the most impact, and focusing your energy on those things is a way to really optimize that. But you have to get in touch with your own personal values, and meditation is a way to do that. Thinking about worry. So anxiety is driven by fear. And sometimes it's a physiological issue, like we've been talking about. Folks with Parkinson's are set up to have more anxiety and depression because emotional regulation becomes more difficult when parts of the brain are impacted by Parkinson's. However, we can really help or hurt ourselves by choosing to worry. So really figuring out, is it a real problem or is this a hypothetical problem? There's plenty of real problems to worry about. So I'm not trying to minimize that in anybody's lives, right? So real problems have real solutions. Hypothetical problems don't really have a solution, or at least not one that's accessible to me or you, right? Big picture worries like war, famine, poverty, homelessness. These are things we all worry about, but in a lot of ways, they're hypothetical worries that we can drive ourselves into a state of anxiety about. Real problem worries are things that we can do something about, and taking action is the best way to manage those worries. But differentiating between the two is important because hypothetical worries can turn into rumination. There's not much you can do about the hypothetical worry, so you're kind of bound to come back to that same worry over and over again because it hasn't changed and there's nothing you can do about it. So you can kind of think of the serenity prayer if you want, the wisdom to know the difference between hypothetical worries and real life worries. And you're looking for serenity, right? When you have anxiety, you want to be calm. So that's one strategy. Maintain a balance in your life. Make sure that you're doing things that are fun. And that, again, I'm not trying to make that sound easy because people with disabilities, chronic health conditions, that's one of the first things they give up is the fun stuff. Well, I got to focus on doing the important things. Fun is important. I mean, that's something that's really critical to understand, especially in healthcare. If your health is compromised and you're trying to achieve optimal health, having fun is actually mandatory because the brain chemistry around fun is what helps us to heal internally. If we're stuck in the sympathetic nervous system, then we're never healing. We're stuck in worry, we're stuck in fight or flight. It's not until we get to the parasympathetic nervous system that we actually start to heal. And that's when we're enjoying ourselves. That's when we feel relaxed and fulfilled. So those things go together, feeling socially connected, feeling like you're making a difference, feeling like you have optimism is associated with healing, physical healing. So it's important to have those things. Speak to your worries with compassion. I love this one. Everybody gets worried about these hypothetical issues, like I was saying. Give yourself some grace and say, oh, you're worried because you're such a compassionate person. You're worried because you care about everybody so much. And there's nothing you can do about this. So having that little internal conversation, great. Yes, you care about people. And you also care about yourself, your family, your caregivers. So focusing on real life worries. And then practicing mindfulness. Social health. I've said this a couple of times, but here's some data, right? A study that really emphasizes the importance of social health. The Harvard study of adult development has been going on for 85 years. And their main question is, how do people achieve happiness? And what they found is social interaction and relationships are really the key. So Embracing community helps us live longer and be happier. Retirees don't miss working, they miss the people. So here's a quote: I get spiritual sustenance from talking shop. It's wonderful to help someone acquire skills. Teaching young people was what started my whole process of exploring. So at the later stages in life, the most fulfilling thing that we can do is share our wisdom and knowledge, pass it on to the next generation. That's how we really fulfill our mandate at this age. Taking on hobbies might not be enough. And I've talked to multiple people just in the last couple of days actually about retirement and their plans. And a lot more people are thinking carefully about retirement. They're spacing it out. They're cutting back on work rather than retiring altogether. They're really seeing the value in the social interactions and relationships that they have at work. And so they don't want to just give it all up at once. A gradual change might be better. So to retire happy, invest in your relationships. And that's the basic gist of the entire study, is that the happiest people are the ones that have put effort and time into maintaining positive relationships with others. And honestly, that's what makes us financially successful and successful parents. Everything that we've done in our lives, we've relied on our social relationships and connections to be successful. And why not continue to develop those into later stages in life? And again, here's a link to that article at the bottom of the page. So talking about professional and self-help for anxiety, there's many different ways to address anxiety. Medical care is one of those. So we have SSRIs, antidepressants, adjusting dopaminergic treatments to accommodate anxiety. Reduce medications that have side effects. There are many medications that have anxiety as a side effect. So really looking at what meds someone is on, what are the kind of interactions between those medications? Is there a way to make things less complex and reduce the side effects? Address comorbidities. There are physical symptoms that exacerbate anxiety. Things like physical fitness and exercise can help a lot. But talking with your doctor about the relationship between anxiety and other issues that are going on related to Parkinson's disease, you could address some comorbidities like maybe depression and feel better. So mental health treatment for anxiety includes cognitive behavioral therapy, family therapy. It's important for others to know that you're struggling with anxiety and that you might behave differently because of that. And people might need some help understanding that and coping with it, coping with the changes in your personality. Or maybe you're a caregiver who needs help coping with the changes in your loved one's personality. Family therapy can help with that. Behavioral activation. This is highlighted because it is part of what I'm going to talk about next week. There are ways to utilize behavioral activation for anxiety and depression that can help someone get out of a rut. And we all know what a rut looks like, right? Somebody who just doesn't seem to want to help themselves. And it becomes very frustrating for the people around them. If you would just do this, that, and the other, you'd feel better. Well, I don't feel like it. I don't want to. When you hear that, you get frustrated. Well, here's an opportunity to help yourself and you're saying no, but we are suffering because we're taking care of you and you're grouchy all the time. So help us help you, right? So I'm going to get into some details about how can you have that conversation in a more compassionate way, and how can you really help someone, kind of a coaching model, to change their behavior over time. Exposure therapy is another thing that a therapist could work with you on, and that's really being exposed to the things that cause stress or anxiety in a safe environment so that you can learn to manage those responses. And then there's acceptance and commitment therapy. Again, fairly specialized approach, but I think it really would work well with any kind of chronic health condition like Parkinson's, because the acceptance part is about the recognition, that life is different now. The chronic health condition is causing changes in your body and your brain, and you have to adapt. And so accepting the disease, accepting the presence of the disease and the course of the disease help someone to then really identify values. It's really all about, what do you want out of the rest of your life, and how do we make that happen now? So I really like this approach. Self-care is very effective in managing anxiety. And there are multiple books out there that will lead you through the process of cognitive behavioral therapy, self-paced, right? It's not ideal to do it without a therapist. But again, people are really struggling to get those services, especially if you're relying on Medicare to pay for them. So Mind Over Mood is one recommendation of a CBT manual that I'm aware of, but there are many on the market that are all pretty good. Exercise is really important. One of the reasons is that, like I was talking about, the fight or flight system and how it's driven by neurotransmitters and hormones like cortisol and adrenaline. Those hormones will get destroyed by exercise. When the muscles of your body are pulling in blood and using the components of that blood to build themselves, cortisol and adrenaline get pulled in as, a form of energy almost. And so exercise will actually help someone get back to a baseline level of adrenaline and cortisol, rather than having chronic heightened levels of those in their bloodstream. Social activity, really important piece. And it's not just about, I'm having fun with friends. When you make these connections, you start to talk about your experience with life. And I'll refer to an experience I've had called Death Cafe, where I hear people talk about this stage of life. And it really attracts people that are, in their 60s, 70s, 80s, to talk about death and the potential of that. But what they really end up talking about is their lives. They talk about their past lives and the things that they appreciate about that. And then they also talk about their current life. And I think people with Parkinson's need an opportunity to talk with others with the same condition about their current life. And it's really similar to support groups around post-traumatic stress disorder, people in the military. If you get them together, they provide healing for each other in a lot of ways when they talk about their current experiences, how they're adapting to their lives. And so I see that as very similar. You want to have that validation and normalization of what you're going through, to know that you're not the exception to the rule necessarily. Support groups do the same thing. It's another version of social activity focused on having Parkinson's, and then meditation and relaxation classes. So that 4 square breathing I was talking about is a basic technique out of yoga. And so any other class like that involves movement, that involves breathing, is going to help someone manage anxiety, because you're learning skills in a calm and safe environment that then you can employ in a stressful environment. So it'll become a lot more natural for someone to start to regulate their own breathing when they start to feel a little bit stressed, right? The heart rate's going up a little bit, body temperature is going up slightly. They'll start to breathe deeply because they know that this is a good technique. It becomes automatic. People start to take deeper breaths, straighten their back a little bit when they feel stressed. So that's a way to incorporate mindfulness and meditation into daily life. So how do we get people to access this care? We know there's stigma around mental illness, stigma around chronic health conditions and aging. So you want to talk to people about their concerns. Have you ever gone to therapy in the past? How did that go? If you were to seek help now, where would you go? And you might have some ideas about that. Typically, you would rely on your insurance company to tell you what professional help is accessible through their contracts. How would you feel about seeing a counselor? Do you want a specific gender or race? What's going to make you the most comfortable? And using telemedicine, is that an option? So having this conversation, and have you talked about medication at all? But just giving someone an opportunity to discuss their concerns around professional help is the best way to start that conversation. I have some online resources, websites that you can go to. And then that's what I have for you today. 1:59, look at that.